Good morning, everyone. We'll get started in just a moment. Letting people join. Okay. Good morning, everybody. Welcome to the Kentucky Harm Reduction and Recovery Community of Practice webinar series presented by Voices of Hope and the University of Kentucky Perinatal Research and Wellness Center. My name is Brooke West. I am a person in recovery and the training coordinator at Voices of Hope in Lexington, Kentucky. The goal of a community of practice is to bring together a group to engage in training, share best practices, and network around a common interest. Today, the topic of our community of practice is hepatitis C elimination. Where do peers fit in? Presented by Katie Gardner with the Kentucky Department of Public Health and Pam Sulfridge with UK Healthcare Target4. So Katie Gardner is a public health nurse and health educator with 17 years of experience in clinical care, including harm reduction and infectious disease care and prevention. Katie currently serves on the board of the Kentucky Youth Health Network, which works to create public awareness of health risks and promote healthy outcomes for Kentucky youth. In her current role as program coordinator for the Viral Hepatitis Program at the Kentucky Department for Public Health, Katie focuses on increasing hepatitis C education and care in communities most impacted by hepatitis C and the overdose epidemic. And we're excited to have Pam with us. Pam Sulfridge is a health education coordinator with UK Healthcare Target4. She has 16 years of experience in behavioral and public health, specializing in substance use disorder, harm reduction, and community outreach. Pam is a graduate of Eastern Kentucky University. Me too, woohoo! Go Colonels! And the University of Kentucky, and holds multiple certifications in case management, recovery coaching, and crisis communication. She is passionate about education, advocacy, and empowering individuals to make informed health decisions. So a few housekeeping notes before we begin. If you are a peer support specialist interested in continuing education credit for this webinar, you will need to complete a survey, and the link to the survey will be placed in the chat toward the end of the session. So hang around to the end to get that survey link to get your continuing education credit. We do have the chat feature on today, so you can participate during the webinar. And if you have any questions, please put them in the chat, or you can use the QA feature to submit your questions, and we'll try to answer those throughout the training. So we are so excited to have this presentation today to learn more about hepatitis C and the role of peer support specialists. So thank you so much, Katie and Pam, for being here, and I will turn it over to you, Katie.
Thank you so much, Brooke, and thank you, Voices of Hope, for having this presentation today, for inviting me. I'm going to get my slides set up. All right, can folks see my slides okay?
Looks great.
Okay, great. All right, and let me know too, sometimes my mic gets a little bit soft, so please let me know in the chat, or you can come off mute, Brooke or Amanda, if that happens. So thank you so much for that introduction. I am really excited to be here today. As a public health nurse and a health educator, hepatitis C is something that I really love sharing information about, because it's something, and we're going to talk a lot more about this later, but it's something that we can cure. There's a cure for it. There's like a pathway to hepatitis C elimination in Kentucky because there's a cure. And I really am excited today to talk a little bit about the ways that you as peer support folks can play a role in that elimination. First of all, just thank you so much for being here. I am excited, that many of you all showed up today to just take some time out of your day to learn about hepatitis C. in my program and a mountain of research shows that peers really play an important role in connecting people who use drugs and people with substance use disorder to hepatitis C knowledge and care. And just thank you so much for, again, just like prioritizing this, taking time out of your day. If you want, you can share in the chat like your name, and I'd love to know just like what roles that you work in. So especially if you're a peer support person, like do you work in a medication for opioid use disorder clinic or a SSP or a clinic or a hospital or a jail or a prison? I'd love to know just kind of what the roles that you all are working in, if you're comfortable with sharing. Oh, do we have chat? I'm so sorry. I meant to check.
Yeah, we should.
Okay, cool, great. And if you don't feel comfortable, that's totally fine as well. But if you would like to share your name and, like I said, the setting that you work in, that would be great. All right, so whenever I do a presentation, I like to start with a content acknowledgement. You know, probably most of y'all showed up today knowing that it was possible that we would be having frank discussions of substance use and misuse, about substance use disorder, but also we're going to be discussing infectious disease and the stigma and discrimination that people who use drugs and people who have hepatitis C experience. And so that's going to be a big part, and we're going to discuss that quite a bit today. We know, you know, statistically speaking, any space that I present in, I know that there will be people in this space who've experienced or whose lives have been impacted by substance use disorder, and or hepatitis C. So we just want to keep that in mind as we, you know, as we ask questions and as we discuss this topic today. Also, I know, again, in any room I'm in, but I feel like especially potentially this room, there's going to be a wide variety of understanding about hepatitis C. To be honest, like I think a lot of folks may not know a lot about it, may not have a lot of experience, you know, kind of thinking about it and learning about Hep C. And then others, I think, probably could teach the class on Hep C today. I'm gonna be honest. I would love, thank you so much for putting your name and your settings, your work settings into the chat. That's really helpful to know kind of like where people are from. I see there's a lot of folks from medication for opioid use disorder clinics, and residential settings, recovery community centers, awesome, from all over the place. I love this. But I would also love, and if you're still sharing your name and your workplace, that's fine. But I would also love to know, like on a scale from 0 to 10, like how much do you feel like you know about hepatitis C? And so 0 would be like, I don't know anything, I'm just learning. I'm so excited you're teaching this class because I don't know anything. And then 10 would be like, yeah, I totally could teach a class. I know so much about it. And like I said, if you want to put it into the chat, kind of your, like I said, just your knowledge level about Hep C. And I'm still like scrolling through. I'm so excited to see so many people here today and also so many different settings represented. Oh, Sparrow Health. And from Ashland, amazing, Lewis County, all over the state. All right, and now I'm seeing these numbers come in. And I'm seeing, you know, like a lot of folks kind of in the middle, maybe like have some things to learn, but maybe know a lot already. Seeing some 2s, 3s, 4s, 7s. So I'm noticing we're like all over the place, which I love. And the reason why I asked this question is because those of you that are kind of on the lower end of the scale, we're going to be doing a Hep C 101. So I hope that you're going to be able to learn a lot today, just kind of the basics about Hep C. But then those of you who are like 9s, 10s, don't think I saw any 10s, but I bet you that you're being modest. I bet there's some 10s out there. Those of you that know a lot already, I'd love for you to kind of think of this as like a train the trainer. So today I'm here to train you to share knowledge about how you can talk to your clients about Hep C. What do you need to know in caring for people and in the settings that you are working in? Especially most of you are working with people at risk of Hep C. Many people you're working with may have hepatitis C. And so how can you share knowledge and kind of combat a lot of the misunderstandings that are out there? We're going to discuss that quite a bit as well. What are the misunderstandings about Hep C? And then lastly, for our contact acknowledgement, just to take care of yourself in whatever way that you need to. Whenever we're having discussions about kind of stigmatized topics, there's definitely a possibility for people to have different feelings come up, and just to take care of yourself in that context. So real quick, our objectives today. Like I said, kind of thinking of this as a Hep C 101 or a train the trainer. So I'd love for you to be able at the end of this to be able to explain to your clients that hepatitis C is common, preventable, and treatable. Sorry, it's not just treatable, it's curable. And number two, kind of understand how stigma impacts hepatitis C care. We know there's a lot of stigma around substance use disorder and substance use. It's important to think about how that kind of plays into this to stigma around hepatitis C specifically. And then number three, understand the role of a peer support professional in helping to connect clients to hepatitis C care. We know that hepatitis C is not on the top of some folks' priority lists for so many different reasons. There are so many health needs that people in the community face, and so much lack of access to health care. We know that hepatitis C can kind of fall down the list of priorities, and we, as kind of healthcare providers, some of us, and also just as people working with people who use drugs and people at risk of Hep C, it's important to help people understand, like, why is this important? Why is this something I should be caring about? Like I said at the very beginning, hepatitis C can be eliminated because there's a cure. And it's so important. We need everybody. We need like all hands on deck to reach elimination in the state. And peer support professionals play such an integral role in this. All right, so I like to make my presentations as interactive as possible. And one way to do this is I'm going to just ask you some questions throughout this training. All of the questions that I'm asking you are about one or another misunderstanding about hepatitis C in the community that I've heard, that my colleagues have heard, that people, that I've worked with in, I used to work in a syringe service program, misunderstandings that people have expressed. So first, we're going to start with some true or false. So true or false. Question number one, hepatitis C is the most common bloodborne pathogen. What do you think, true or false? And you can just put T or F or true or false into the chat. All right, seeing some trues, seeing some false, seeing a lot of trues. All right, this one is true. So hepatitis C is the most common bloodborne pathogen. When we're thinking about bloodborne pathogens, those are, some other examples are like HIV, hepatitis B. It affects millions of people across the world. It impacts millions of people in the United States. Up to 1 to 2% of people in the United States have hepatitis C. And it's important to know that it accounts for the greatest number of deaths and the highest mortality rate of all the viral hepatitis. So there's Hep A, Hep B, Hep C. Today we're just talking about Hep C. And among all of those, Hep C causes the highest number of deaths. All right, question number two. Hepatitis C treatment lasts 1 to 2 years and have many side effects. Do you think this is true or false? Got some false, got some true. Got a lot of falses. Lost my mouse. This one is false. We're going to talk more about this later, but today's treatments are so different than the old treatments. Many of us know people who received Hep C treatments back in the 90s, kind of early 2000s, and they were really difficult. They were hard on the body. They didn't work very well. But today's treatments, which started coming out about 10 years ago, they're super effective. They're really well tolerated. There's a lot of myths about them, especially like that they require sobriety. That should not be the case. Medicaid will cover, and in Kentucky will cover the first round of treatment for people who are actively using drugs, and also their pills, and that they're completed in 8 to 12 weeks. This is such important information for us to get out to our clients, and there's so much misunderstanding about this in our community. And we're going to talk a little bit more about this later on. Question number three, true or false? Hepatitis C is only spread through needle sticks or sharing syringes. What do we think, true or false? All right, I have a unanimous, this is false, and you all are correct. This is false. There are actually many different ways that Hep C can be transmitted. This is a list. We're going to talk more about this list later, but it's really important. Like the main misunderstanding that we find in the community is that people think that people can only get Hep C through sharing syringes, and that is not the case. It can be spread in, like I said, a variety of ways, but it can even be spread if people don't inject drugs at all. Or not sharing syringes at all, through equipment that's used to prepare and inject drugs, equipment that's used to prepare or inhale or smoke substances as well. And then you can see, like I said, other ways to transmit it in addition to substance use as well. And we're going to talk more about that later. All right, last of these kind of intro questions is true or false. This one may be pretty self-evident, but number 4, the attitudes and beliefs of health professionals have the potential to influence the quality of care that people who use drugs receive. What do we think about this one? True or false? I see. Absolutely. Another unanimous. This is true, of course. And again, mountains and mountains of research shows that stigma among health professionals towards people with substance use disorders and people who use drugs in general have consequences. They have consequences where people won't show up. They won't seek medical care even if they need it, and people won't get the health care that they need, including hepatitis C care. And even if they do seek care, sometimes they receive care that's of a lesser quality. So again, we're going to be talking about this. I know probably this is something many of you all could teach a class on as well, but we're going to be talking specifically today about how this impacts hepatitis C care. And we're going to start here. This is a chart that the CDC came out with a couple of years ago, showing how many people who are diagnosed with Hep C, how many of them receive treatment. And you can see it's amazing to me how few people, it's not amazing, but it's really remarkable how many people that are diagnosed with Hep C are not receiving the cure, are not receiving treatment. And this is just out of people who are insured, right? This doesn't include people who are uninsured. So people with Medicaid, only 23% of people with Medicaid receive hepatitis C treatment. It moves slightly up with Medicare and then slightly up with private insurance, but still the majority of people that are diagnosed, regardless of their insurance type, are not receiving hepatitis C care. And one of the reasons why is due to stigma. There are a lot of reasons, but one of those reasons is stigma. So where do you all fit in? I'm sure a lot of you are already thinking about, or already know different ways that they are, that you all can help in this. Like I said, this kind of hoping to end hepatitis C in Kentucky. And this is some of the ways that you can fit in. And I see a question in the chat. Why are people not getting care? So I'm thinking that question maybe is like, why aren't people getting Hep C cure or treatment? And the reasons are many. There are so many barriers to hepatitis C care. And we're going to talk a lot more about those later. But I definitely believe, and it's been shown that stigma can play a huge role. People who have Hep C feel nervous about seeking healthcare, potentially due to bad experiences they've had in the past, maybe because their friends have had bad experiences. I think to some extent, some of those reasons are around the misunderstandings about hepatitis C and maybe thinking that they can't get care if they, for instance, are actively using. But then also there's all those barriers to just healthcare in general. So transportation, lack of housing, and all kinds of barriers to getting healthcare. But that's a great question. Thank you for asking. And I hope that I'll kind of address some of the reasons why through this presentation. But if I don't, if you still have questions later on, please, feel free to ask. So when I think of peer support professionals, this is what I think of. And I know that you all do so many different things that I couldn't put them all onto a slide. But these are some of the things. I know that you connect with your clients. I know that you validate clients and that you encourage them when you let them know that you believe in them. You acknowledge when they are taking a positive change in the direction of their health. And you understand that one step towards health just can build on the next step and the next step. And hepatitis C care can be one of those steps. And you also advocate for people. And many times you're able to walk with people, like literally or figuratively. You're able to help connect people to the services that they need, help them make that phone call, follow behind them to the appointment and make sure that they get there okay. There's, of course, keeping professional and personal boundaries in mind. There's so many ways that you're able to really help somebody along their pathway to recovery. And a lot of those cross over into how you can also connect them to hepatitis C care as well. Specifically, some ways that peer support professionals can help connect people to Hep C care are providing helpful, accurate information, right? That's hopefully what we're going to be covering today. Also decreasing stigma and shame, again, around substance use, and also specifically around hepatitis C infection, helping to decrease discrimination in healthcare settings, and then providing hot handoffs. And we're going to talk a lot more about this, and Pam's going to address this later in her discussion. But there are ways that we can not just if, for instance, if somebody tests positive for Hep C, give them a list of resources, but help connect them to those resources as well. You can make a difference. Again, you're a really important part in this fight to eliminate Hep C in Kentucky. And thank you for being here. So what is Hep C? Really basically, hepatitis C is a virus. It is just like any virus, it's spread when someone comes into contact with someone with the virus. In this case, it's bloodborne, so it has to be blood-to-blood transmission. Like I said before, it's very common. It's the second leading infectious cause of death globally, and also a leading infectious cause of death in the United States. And it's one of the leading reasons someone gets liver cancer and potentially might need a liver transplant. Oh, I see a question. I've been asked that the percentage of those treated, is that of those who've been diagnosed or of those who are, that's a great question, Evan. That is people who are diagnosed. So, and that's a great point that you're making, is there's a ton of people that don't even know that they have Hep C. A lot of people haven't been diagnosed yet because they haven't been tested. Yeah, that's a great point and a great question. So when someone has hepatitis C infection, and they don't get treatment, that often that will progress to liver disease. And so you can see this is kind of a visual representation of someone has Hep C infection. They start with a normal liver, then the vast majority will go on to develop chronic Hep C. There are cases where people clear the infection on their own. That definitely happens, but it's the minority of cases. Most people will receive or will go on to develop chronic hepatitis C. And yeah, thank you so much, Dia, for sharing that resource in the chat. So yeah, there's some great information about hepatitis C treatment. Then of the people with chronic hepatitis C, a significant portion go on to develop liver disease or cirrhosis. And then of those, every year, 1 to 4% will develop liver cancer, and then 2 to 5% will go on to develop end-stage liver disease. And that would be the point where somebody might need a liver transplant. So you can see if hepatitis C is not treated, there's a lot of consequences that can happen. This is just a estimate of chronic rates in Kentucky compared to the national average. Again, this is just an estimate. Chronic hepatitis C is not a reportable disease in Kentucky, so we don't have great numbers. And like we talked about before, there's a lot of people who have never been tested and they don't know their status. And you can see that across time, we've had higher rates, and then our rates are rising significantly. This is an estimate of the ages in Kentucky of people with hepatitis C between 2018 and 2023. Historically, hepatitis C has mostly impacted people that are baby boomer age, and that's still the case. They are more likely to have hepatitis C than the average population, but we're also seeing the numbers trend low, the ages trend lower and lower. And that is definitely related to the opioid and overdose epidemic. More people are injecting opioids and drugs, and so that is contributing to people being younger and younger having hepatitis C. And this has implications, especially for people of potential people of childbearing age. More and more people are being infected with hepatitis C, and that there are implications then of passing that on to an infant during pregnancy or birth. And we're going to talk more about that later. This is just a graph kind of showing how Appalachian counties are the most impacted by hepatitis C. So when we compare it to the Kentucky average and the and non-Appalachian counties, you can see that Appalachian counties, the dark blue, have a much higher rate. And just to know, if you're living in an Appalachian county, then likely the rates there will be higher than in other parts of the state. And this is acute. Sorry, this is specifically acute rate. So this acute hepatitis C is reportable. So these are the numbers of people who have been reported as having acute hepatitis C, and that's like the early part of the infection. So we know that injection drug use is the most commonly reported risk factor for hepatitis C. There's a lot of different ways that people can get hep C, but injection drug use is the most commonly reported. So that's an important risk factor. We know that, this was a study that was done a couple years ago based on syringe service program data. We know that people are utilizing syringe service programs. And so we do know that there are, a significant number of people that are using drugs by injection use. And so that's important to know as a risk factor. Another important risk factor to understand is incarceration. You can see based on this graph that Kentucky has rates of incarceration much higher than the United States, and then also much higher than many other countries. And that's important to understand because the proportion of hepatitis C is much higher in correctional populations and populations of people who are incarcerated. As much as like between 10 to 50% of people who are incarcerated versus 1% of the general population. And also that approximately 30% of people living with hep C will pass through the carceral settings at some point. Our carceral population are just part of our community. And the vast majority of people who are incarcerated will be then released to the general population and to their communities. And so this is not just a problem facing carceral populations. This is a problem facing our whole community. All right, here's another. So throughout, I'm going to have just a few more quiz questions. It's basically a quiz without any prizes and without any consequences. So no worries, if you know the answer, great. If you don't, no worries. But I'm just going to ask a couple of questions, more questions throughout the presentation. And again, all of these are based on myths in the community. So pop quiz number 1, people can give themselves hep C. Is that true or false? What do we think? We got a lot of trues. We got a false. Got a lot of trues and a few falses. All right, this one is false, actually. This is one of the #1 kind of myths or misunderstandings that's in the community. I hear this all the time. This is very, very common. And I think there's a lot of reasons, I could guess a lot of reasons why this myth kind of got started and gets spread. But hepatitis C is a virus, and just like any other virus, you can't give a virus to yourself. You have to come into contact with someone that has that virus. And again, with hepatitis C, this is a bloodborne virus. And so anyone can get hep C if they come into contact with blood from someone who's infected. All right, let's see. I'm seeing some, let's see, I do not see or hear hep C being discussed at primary care appointments. That's so true. Mainly only hear about it in SSPs and pop-up testing. Yeah. So what are some places, settings that people can increase education and testing? Everywhere. But that's a great question. Everywhere. And I totally agree. There's not enough talking about hep C in primary care settings. So definitely ask your doctor to get tested, ask them why they're not testing. Why didn't you have a conversation with me about hep C? Primary care is definitely a place where there needs to be more education and testing. And I really do think that it's just based on stigma is the main reason why that doesn't happen. And also a misunderstanding of maybe it's not in my community. Well, it is. It's not, anybody could get hep C. Everybody should be tested for hep C. And people think that you can get it from your own blood dried in the syringe. That's correct. That's one of the, like I said, one of the biggest misunderstandings in our community. But it's important to, it's important for us to understand that as we're giving information to our communities, and also, for our clients to understand. So, I mean, that can have some stigma around it. We don't want them, feeling bad because they thought that they gave themselves Hep C. Yeah, exactly. Talk about that Hep C is not just a disease for, people who inject drugs. Exactly. And if somebody has Hep C, it doesn't mean they're a bad person. It just means they've come into contact with Hep C at some point in their life. So we talked about Hep C as a virus and how it's spread. The really important thing to walk away with is the understanding that Hep C can live outside the body for up to 6 weeks. And so that means, like, on a surface, in a syringe, on a straw, on a pipe, on, a surface that someone used to prepare drugs. Hep C virus can live up to 6 weeks. And that's what makes it so contagious. That's what makes it so, it's just a really strong, really small virus. It can be transmitted with blood like that you can't even see, right? It could be on that surface, but it is invisible to the eye. And so it's really small amounts of blood that can transmit Hep C. This is that list that I showed earlier. So we've talked about how injection drug use can transmit Hep C, but also anything that someone uses to prepare or inject, inhale, or smoke illicit substances is possible to transmit Hep C. Tattooing, piercing is possible. Anything like that's used to tattoo or pierce. So the ink, the pot that holds the ink, the gun, the surface, right? Anything that's used for tattooing can transmit Hep C if it's not sterile. Sexual contact is rare, but it's possible, especially when blood is present. Medical procedures is possible, but very uncommon, in the United States, like in hospitals and doctors' offices. Needle stick injury is definitely possible for people working in healthcare or sanitation or that kind of thing. And then exposure of infants during pregnancy or birth. And we're going to talk more about that in a minute. And then it is possible to share hepatitis C when people share toothbrushes, razors, or nail clippers. It's really unlikely, but it is, or uncommon, but it is possible, especially for people in like carceral settings or other congregate settings. It's really important that people know that it is not transmitted by sharing clothing, eating utensils, or food or drink, coughing, hugging, holding hands, kissing, breastfeeding. The one caveat here is if people are breastfeeding and they have hepatitis C, is if they have cracked nipples or, sores or anything like that, then they should avoid breastfeeding during that time, because it could be transmitted if there's an open wound, basically, but not through breast milk. It's not spread through breast milk. All right, so a little bit more about perinatal hepatitis C. The word perinatal means the period before, during, or shortly after birth, and it refers to both the birthing person and the baby. So it's like all of that kind of wrapped up. It addresses all of that. And chronic hepatitis C infection occurs in about 6% of all infants that are exposed during pregnancy or delivery. So that means, like, if the person who's pregnant has Hep C, their infant could be, or 6% of the time, their infant will go on to develop chronic Hep C. It is the most common route of hepatitis C transmission in children. And it's important to know that Hep C treatment can begin at 3 years of age. So treatment can be started till 3 years old. But if infants test positive for Hep C, they can get care. They can get connected to care, like with a pediatrician that specializes in Hep C, but they can't get treatment until 3 years old. And that's really important because I know many of you are working with people who are pregnant, or also people who might become pregnant. And so this is just really good information for you to be able to share with them. And another reason why it's so important that they get, pregnancy care and perinatal care. Unfortunately, often infants or children that are exposed during pregnancy or birth are not tested and then not referred for Hep C care. They can kind of fall through the cracks sometimes. There's a lot of reasons this happens. Pediatric providers, a lot of times, like we talked about, primary care providers aren't really thinking about Hep C. A lot of pediatric providers are also not thinking about Hep C, and so they're not necessarily testing the infants that need to be tested. A lot of infants that potentially have chronic have been exposed to hepatitis C during pregnancy or birth may not receive regular care. And also, if they do, they may kind of have changes in providers, and that information may not pass with them to different providers, or changes in their living situation. For instance, foster care, kinship arrangements, maybe that information isn't passed to those foster parents or to those, grandparents or other guardianship arrangements. All right, pop quiz number 2. Everyone with chronic hepatitis C has stomach pain and jaundice. What do you think? True or false? We have a lot of falses. Wonderful, because you are right. Many people with chronic hepatitis C have no symptoms for a really long time. And unfortunately, liver disease could be happening all the while. These are some of the symptoms of acute hepatitis C. Like I talked about before, acute Hep C is kind of the early phase when somebody's first exposed to Hep C. They could go on to get acute infection early on, and then in most cases, they'll go on to develop chronic hepatitis C. So this is a list of those symptoms. And the symptoms could be the same for chronic, but also it can take decades for symptoms to develop. So even if somebody doesn't have symptoms, they may still have Hep C, and they could pass the virus to someone else. So that's important to keep in mind for prevention purposes, but also for the person who potentially has Hep C, liver damage could be happening the whole time, even if they don't have symptoms. So this is a question for you all. How can somebody know if they have Hep C? If maybe they don't have symptoms? Yes, exactly. Get tested. Can it take decades to become detectable? My understanding, that's a great question. My understanding is usually someone will be detectable within 6 weeks or a few months after exposure. So that's most cases. Get tested regularly. I love that. Not just get tested regularly. That's exactly right. The only way for someone to know if they have hepatitis C is to get tested. So who should get tested? According to the CDC, every adult should be tested at least once in their life. Testing should occur during each and every pregnancy. And people with risk factors should get tested regularly. And we talked about some of the risk factors earlier, but we do know that especially when we're thinking about primary care providers or health providers in general, it really can be beneficial for them to test regularly, because it's not, people don't necessarily always talk to their healthcare providers about their risk factors, right? And so getting tested regularly is something that is really important. Anybody could get Hep C, so anybody should be tested for Hep C. And thank you so much, Dia, for sharing that information. Yeah, antibodies can usually be detected within 3 months. Going back to talking about perinatal hepatitis C, infants should be tested between 2 and 6 months of age. They can't get tested until they're 2 months old. And then starting at 2 months old, they can get tested with an RNA test. And we're going to talk a little bit more about that, although it's real complicated and you don't need to understand all the ins and outs of it. But there's a specific test that infants 2 months of age and older can get. And they really should be getting, if they potentially were exposed during pregnancy, again, 6% of them will go on to have Hep C. So they really need to be identified early so they can get connected to hepatitis C care with a pediatrician that specializes in that. And then again, once they're 3 years old, they can then get treatment. Hep C testing is complicated, and that's just the reality. It's a journey to get Hep C treatment, and part of that journey is these steps of getting tested. In a lot of cases, especially a lot of the settings that you all are working in, if you're working in a syringe service program or some medication for opioid use disorder clinics, they'll do a finger stick test first. And right now, most of the time that's testing for antibodies. And if that test is positive, for antibodies, that means that at some point that person's been exposed to hepatitis C. Maybe they were exposed and they cleared it on their own. Maybe they were exposed and they got a cure, and they're cured. Or maybe they got a test, they tested positive and they actually have the infection. And so that just shows us that is just a preliminary test. It just tells us they've been exposed to Hep C at some point in their life. And then the next step is to get a confirmatory test. And that's to tell us whether they're infected with it currently, if the infection's active in their body. And that's called an RNA test, but also we can just call it a confirmatory test. If this test is positive, that means that they do have the infection. If this test is negative, or if the antibody test is negative, it means that they don't have an infection and that they should just go ahead and keep getting routine testing. Like we talked about before, get tested regularly, and then also decrease risks to getting hepatitis C. If someone tests positive and we know that they have the active infection, then at that point, the doctor might do further testing, some more blood tests to check their health and their liver health, and then they might go on to prescribe treatment. There's two resources here that I'm going to share in the chat. Maybe I'm not going to share in the chat, but you can use the QR code if you'd like. And also, if you're interested, I can send these links out afterwards. I'll share my email address if you'd like to receive this information later. The top one is gettested.cdc.gov. This is a resource the CDC has about where to get tested in general for STIs, and Hep C is one of the things that's included in these lists. And then also many surround service programs offer testing as well. And I see Bennett was talking about different genotypes. Yeah, there are different genotypes. The good news is for treatment, most of the treatments that are out there today treat all the different genotypes. So genotype matters in certain circumstances, but it also, thankfully, most of the treatments that we have treat all the different types of genotypes. All right, pop quiz number 3. Which of these statements is true? A, hepatitis C treatment requires sobriety. B, hepatitis C treatment can only be taken once. C, hepatitis C treatment is not covered by health insurance. D, all of the above, or E, none of the above. None of the above. We have a lot of E's. And you are correct. None of these are true, even though, unfortunately, even though it seems like a lot of you all know this, our community, a lot of people do not understand this. I just talked to someone the other day who told me, oh yeah, I went to the doctor a few years ago and they told me that they wouldn't treat me for Hep C because I was still actively using. And unfortunately, there are doctors that won't treat if people are actively using, but that should not be the case. People should be able to get treatment if they are actively using drugs. Medicaid will cover the first treatment for people that are actively using. And there's no reason, there's really not any reasons why someone who's actively using drugs should not receive treatment as long as their doctor, as long as their doctor prescribes it. So again, initial hepatitis C treatment does not require sobriety in Kentucky. Treatment can be taken more than once if needed. For instance, if someone's reinfected, and that's important to understand too, is that just because someone cleared the virus on their own, or just because someone gets cured, they still can get the infection again. So it's not like a one and done kind of thing. Treatment can be taken more than once if needed if someone's reinfected. And then also hepatitis C treatment is covered by many health insurance plans, and there's prescription assistance programs out there for people who are uninsured or underinsured. And I'm going to talk a little bit more about that in just a minute. All right, the main message here that we need to spread is Hep C can be cured with treatment. And without treatment, Hep C, most people with Hep C will go on to develop lifelong infection. Again, most people won't clear it on their own. And then if people don't get treatment, then their chances of having serious complications like liver scarring, liver cancer, death are increased if they don't receive treatment. We saw, just like we saw the graph earlier, only a third of people diagnosed with Hep C receive treatment. And there's even less for people that, like, the younger someone is, the less likely that they're going to get treatment. And again, less than half of people will clear the virus on their own. So treatment will be needed for most people that have chronic hepatitis C. This is a QR code for a CDC hepatitis C treatment locator. It's not, I'm going to be honest, it's not the most updated, best resource, but it's a good place to start if someone's ready for Hep C treatment. This can be a good place to start, but we're going to talk about how important it is to know what the Hep C resources in your community are. And Pam's going to talk a lot about that in just a little bit as well. Again, these are these main messages we need to get across to our clients, especially if they test positive for Hep C. These treatments we have nowadays are have cure rates of more than 95%. They're easy to take for most people and have few side effects. They're covered by most health insurance. They should not require sobriety. They're pills that are taken daily, and usually the treatment is completed in 8 to 12 weeks. This is the prescription assistance program that I talked about. Many different drug companies offer prescription assistance programs for their medications, not just for Hep C treatment. And there's an organization here in Kentucky called the Kentucky Prescription Assistance Program, and they really help connect people to these resources. Unfortunately, the prescription assistance programs are oftentimes really complicated. It's hard to know like what information's needed for them. They are sort of an administrative process, filling out forms, that kind of thing. KPAP can help people to do this. There's a hotline that people can call, and there's a website. But also you all can become advocates. And what that means is that KPAP can train you all, not just you all, but anybody, to become an advocate. And that means that they share their software that helps make it easier to connect people to these prescription assistance programs that make medications much cheaper for people and sometimes free. And they share this software with you and they train you how to use it. And this is something that our communities really need. Again, not just for hepatitis C treatment, but for so many of these medications that are really expensive. And again, it's really complicated to figure out like, you know, how to get these programs for patients. And so you can become an advocate, and this is the email to reach out to if you're interested in doing that. All right. Last pop quiz question, true or false? There is no vaccine for hepatitis C. What do you think? True or false? We got all true so far, and you are correct. There is no vaccine for Hep C. There are vaccines for Hep A and Hep B, but not for Hep C. And that's why it's so important, prevention and harm reduction, as well as reinfection prevention. These are some different ways that we can that Hep C can be prevented, and also reinfection can be prevented. So number one is if people use drugs, to avoid sharing syringes, pipes, straws, or any equipment or surfaces used to prepare drugs. Again, not just syringes. Yes, syringes. Thankfully, we have syringe service programs across the state that can help connect people to sterile syringes and other services, but it's not just syringes. Also using condoms or other barrier methods and lubricant during sex. Again, this is important. It's not common to be sexually transmitted, but it is possible. And so that's why barrier methods and lubricant are so important. Again, utilizing professional shops when possible for tattoos and piercings, and always using sterile equipment. Again, avoiding sharing toothbrushes, razors, nail clippers, and other hygiene supplies, especially in congregate settings. Getting tested, right? If somebody knows their status, then they can get treatment and also communicate about it with their friends and family. Getting cured, getting treatment can prevent Hep C, because if somebody doesn't have the virus anymore, they can't transmit it to anyone else. And not waiting, right? Because transmission risk continues if someone has it, even if they don't have symptoms. And also it can cause further damage to the liver. And this one's the part that's really can be tricky. I think especially tricky is communication. People really need to, we really need to increase communication about hepatitis C. Again, primary care providers need to be asking their patients about it, right? Need to be testing their patients. But also we need to be talking to our clients about Hep C. We also, you know, if someone has Hep C, then it's important that they talk to their friends, family, healthcare providers about it. And also that's hard because there's so much stigma around Hep C. And so we as a community really need to work on decreasing the stigma and addressing the stigma around Hep C. And harm reduction really is what we're talking about when we talk about reinfection prevention. So again, someone can get Hep C more than once, but there are ways to prevent that reinfection, and that is through harm reduction. We know that not everyone who who has hepatitis C is ready for long-term recovery. We know that long-term recovery doesn't look one specific way. There's many pathways to recovery, and providing harm reduction education at every step along the way, regardless of, of anything, preventing it for everyone, is really important. And most of you all probably already know this, but people who utilize harm reduction programs and utilize harm reduction principles are taking a step towards being healthier. And when we meet them without judgment, without shame, that can help them. And also, we know that when we meet people where they're at, with respect, that they often feel encouraged and they feel like they can take that next step towards health. And hepatitis C cure can be a really, really clear, really tangible next step in someone's journey to health. Many of you all are already aware, this is just a visual representation of where the syringe service programs are in Kentucky. They're all over the state. This is important when we're talking about harm reduction, when we're talking about prevention and reinfection prevention. SSPs, syringe service programs, offer a number of services, right? This is a long list of services and more. They often offer HIV and Hep C testing, counseling. Some offer in-house treatment. They actually provide treatment in the SSPs. And if not, many of them will provide linkage to and referrals to treatment. Again, we've discussed this a lot. Just a reminder, Hep C is often associated with either perceived, current, or past substance use. And for that reason, it's got all this extra stigma around it. Also, infectious diseases in general, of course, just have stigma as well. But stigma can contribute to people avoiding getting tested and avoiding, if they've tested positive, getting treatment. This kind of manifests in two different ways. There's internalized stigma, so like the stigma that we feel in ourselves. That could be, for instance, fear of giving Hep C to friends or family, or shame, or guilt, or sort of especially if people have potentially used drugs or injected drugs in the past, they kind of have that association and may just not want to think about it, may not want to get tested and treated because they just don't want to think about that. But then, of course, that's all because of external stigma, and that external stigma is from healthcare providers. People experience discrimination based on this. Unfortunately, friends and family often can perpetuate stigma, and also society at large. There's so much stigma around hepatitis C, infectious disease, and substance use specifically. I'm getting close on time, so I'm going to kind of speed through these, but I already warned Brooke, but I'm going to do a plug. Brooke West with Voices of Hope teaches an excellent motivational interviewing class, and I took it at last year's peer conference. Amazing. If you have an opportunity to learn this with her, it does a fantastic job presenting it. I bring it up because when it comes to Hep C education, we can educate ourselves all we want, but we can't make somebody get treatment. We can't make somebody get tested. And knowing about motivational interviewing can help bridge that. We can help try to figure out when is somebody ready, and when is somebody we can listen for change talk. Like, when is somebody kind of talking about, oh, maybe, I don't know. I have a friend who, had Hep C. He got those interferons. He got those old treatments. It made him sicker than a dog. But, I hear these new treatments. I don't know. I've been hearing about them. What do you know about them? That's change talk. That's somebody thinking about getting treatment potentially. And then we have a number of questions we can ask to try to get closer to figuring out, are they ready? Can we support them? Is there information they don't have that we can share with them? So again, number one would be, why would you want to make this change? Why would you want to get treatment? How might you go about this in order to succeed? What are some reasons to get treatment? What happens if you don't? And they may say, I don't know. And that's where you can provide information for them. Number 4, how important is it for you to get treatment? Why or why not? Why is it important, or why is it not important? And number 5, listen to their answers and then ask, what do you think you're going to do? How do you think you can make this change? When we think about this, there's a psychologist named Carl Rogers who really like puts this into like, I think a really understandable, relatable quote, which is the curious paradox is that when I accept myself just as I am, then I can change. And I so relate to that. Like if I'm going to make a change, I'm going to do it. It's not going to be because somebody's making me do it. And that's so true for so many people. And the role of a peer support person is accepting someone as they are so that they can get, so that we can figure out when they're ready for change and then help them to decrease barriers at that point and help them to get linked to care at that point. Pam is going to go into depth about this, so I'm just going to go through it really, really kind of quickly. But there are some steps to somebody's ready to get tested, ready to get treatment, and this is how we can help them to get to that cure. So first is figuring out where they can get testing. And like we said before, that's unfortunately not always one test, it's sometimes two or more tests. So where they can get tested, like antibodies, where they can get confirmatory testing, and then also where they can get treatment. And I just encourage all of you, just do some Google searches, ask your community, ask some healthcare providers in your community, where can somebody go if they want Hep C testing and treatment? Like I said, the CDC has a treatment locator, but it's not the best tool. The best tool is you all. The best tool is people in their communities knowing what the resources are in their communities for Hep C testing and treatment. Again, sometimes these things don't happen all in the same place. It's nice to know clinics that are kind of vetted, that offer person-centered care. And then you can create a resource list. If there already exists a resource list, that's wonderful. But if it doesn't exist, then you all can help to create that resource list for people so that we know where to send people for testing and treatment. Number two, figure out the barriers. Like we talked about earlier, there's so many barriers to getting testing and treatment. And especially when we're talking about treatment, there's all these kind of extra barriers, like if they're going to get treatment, where are they going to get that medication sent? Where is it going to be stored? Do they have health insurance? Do they have a phone? Do they have access to technology? Do they have transportation? So identifying and then helping to address those barriers and then advocating for them. And we talked about this before. This is both advocating for the individual patient, but also advocating for Hep C care in general. And one of those things is to offer Hep C care in the places that people need it are already getting healthcare. So maybe that's an SSP, maybe that's an MOUD clinic, maybe that's a jail or a prison. We really need to be advocating for these services to be available in the places that people can use them. And then follow up if possible. If they're missing appointments, why are they missing appointments? What are the barriers? How can we address those barriers and help them to plan for success? This really is just another visual of that. I think I went over all of this, pretty much all of this. These are those resources again. And again, if you're interested in more information about these resources, reach out to me. I'm actually going to do it right now. I'm going to put my email into the chat. And I have a scenario, but we've already gone over that. I want to touch really briefly on something that's really, really important to me in my role, and also just kind of like a framework that I think that many of us are already thinking in, but it's like giving a word to it, and also just encouraging everyone to think about it. Right now, we're in the midst of a syndemic, and this was a new word to me. I just learned it a couple years ago. It's kind of a public health word. And a syndemic is when two or more diseases or health conditions cluster, like they occur together, and then they interact within a specific population. And we know that structural issues make these health conditions worse: stigma, lack of access to care, discrimination. All kinds of structural issues make these health conditions worse. And unfortunately, this leads to health disparities. So what I'm talking about is all of these different all of these different health conditions that we find due to the opioid and overdose epidemic. So we're finding we're finding that rates of Hep C, HIV, syphilis, and hepatitis B are increasing in certain communities. We're finding substance use disorder in many communities. Opioid overdose rates, are still very high and are actually, really high in certain communities. And then non-bloodborne infections, so that would be like wounds or heart infections, that kind of thing. We're finding an increase in those as well. And these all, they occur together and they interact with one another. And what really the take home here is that if we're working with someone who uses drugs, or someone who is in recovery for using drugs, or someone who, has substance use disorder, we're working with someone who is potentially at risk for all of these. Not saying that everyone that has hepatitis C is going to overdose, and not saying that everyone who overdoses has hep C, but we know that there's a relationship there. And so when we provide education, for instance, about hepatitis C, we also need to be providing education about overdose, about all of the aspects of this syndemic. And we also need to be working on decreasing stigma for all of the aspects of this syndemic, not just one. So the reason I bring that up is because we know, I know probably many of you already know this, but we really need to be making naloxone as available as possible, especially in these higher risk populations. This is a great resource. Find naloxone now, ky.org. You can see on this map all of the places across the state where someone can get naloxone. If someone's at risk for hep C, they potentially could be at risk for overdose as well. There's definitely a relationship there. So we need to be connecting those resources. Also, Find Help Now, wonderful resource. Again, we've got the naloxone tab on there, but also help with mental health treatment, substance use disorder treatment, and recovery housing. And again, I just want to drive home that you all play such an integral role in our fight to eliminate hep C in this state. And I hope today that you've been able to kind of see the ways that you can help us in this fight to increase education and dispel those myths, to help people to get tested, treatment, and help people to prevent hepatitis C as well. We have educational materials on a red cap. If you're interested, you can download those using this website and this QR code. Also, we have an email list if you'd like to. We have a couple meetings a year where we talk about hep C on like the statewide level and like how you can play a part. Even if you don't think that you're the person for this coalition, this Viral Hepatitis Coalition, you are. We really need as many people with lived experience of substance use and potentially lived experience of hepatitis C as possible, as we really work on eliminating hepatitis C together. You can sign up here for that. And unfortunately, I can't get to my copy and paste, so I can't put these in the chat, but like I said, email me and I can send all of this information to you. And then last but not least, this is our program. Oh, thank you, Dia. This is our program staff's emails. We have a website. You can look at it here. And then our program's email is vhp@ky.gov. And I'm sorry, I went over a couple of minutes, but I also wanted to just see if I'm going to pass it over to Pam in just a minute, but just to see if there were any questions before I pass it over to Pam. And also you can ask questions at any point, and you have my email now, you have our educational materials and our coalition email sign up. So feel free to reach out to us any way you'd like. I'm so excited to pass this over to Pam. I got to meet Pam pretty recently, but she's just like amazing peer support professional, amazing teacher, educator, and just like really just as passionate about this work as I am, and is going to be able to share her personal experience in helping to link people to hepatitis C care. So I'm going to stop my share. And here's Pam. Thank you so much.
Thank you, Katie. That was wonderful, very educational. I'm going to go ahead and share my screen, and I've also placed my email in the chat box in case anyone would like to reach out after the training. You're welcome to do so. And one of the things that I'm going to talk about is just to kind of tag off of Katie's presentation is where do we fit in as peer support? How do we assist now that we have all this wonderful knowledge that Katie has provided us with? How do we assist our clients in moving forward and in getting the treatment that they need? So how do we do that? And we're going to talk just a little bit about that. Again, thank you for the introduction, Brooke, earlier. This is some of my contact information. I am a health educator with UK Healthcare and a peer support instructor with Southeast Kentucky Community and Technical College. And my email is on the screen and also again the chat. We're going to talk about tips for working well with our peers. We're going to talk about building trust, being non-judgmental, providing a safe environment so that clients can feel that they can come and seek that assistance from us. Meeting clients where they are for up-to-date information. We also want to encourage clients to continue to have the conversation with us, have open conversations, and create that environment that they feel they can bring anything safely to us. And also, we're going to talk about how important it is to stay up to date on hepatitis C treatment and hepatitis C knowledge. So the first thing we're going to talk about is how to create that comfortable and safe environment so that your clients do feel that they can come and speak about this topic or ask further questions or maybe even get involved in treatment. So first things first, we want to foster that trust with our clients, making sure that we're providing a warm, welcoming space and that it's a judgment-free zone and it's open for any and all conversations that are pertaining to the betterment of this client's health. Also, we want to encourage that openness. When we have that open relationship and we have that environment that a client feels that they can come and talk about things, they are more likely to share and they are more likely to open up and ask those questions when they are feeling safe. We also want to make sure that it's a stigma-free environment. We want to reduce have hepatitis C or they're at risk for hepatitis C, they face judgment. And when we are providing support and we are providing a space where it's a judgment-free zone, that helps break that stigma. That helps break that barrier for that individual to get the treatment that they're seeking. We also want to be non-judgmental. I think that goes along with reducing that stigma and creating that safe space. Practicing active listening is huge. Letting our clients know through our words, our body language, that we hear them and that we see them. Also, we want to respect their privacy. Make sure that we're keeping everything confidential, especially a lot of times you'll hear that small town gossip if you're from a small area, and you'll talk about clients with your friends, your coworkers, your family members, and we really want to make sure that we're not doing that so that we are ensuring their confidentiality so that trust can continue to build. Using empowering language, making sure that we're using language and not jargon, language that they can understand. Also, make sure that we're keeping a comfortable environment, provide a space that is quiet, a space that is not too hot, not too cold, where they can feel comfortable when they're coming to meet with you. And also invite questions, make room for open discussions. The next thing we want to do when working with our peers is making sure that we're staying informed. When we're staying informed, we must stay up to date on the information around hepatitis C treatment. When we're doing that, we're able to pass this on to our clients and we're able to give them accurate information. A lot of times, topics around hepatitis C and the treatments are ever evolving. And so that's why it's so important that we stay up to date on current knowledge. When we are informed as well, we can empower our clients. And we do that by offering this knowledge to them, offering this up-to-date knowledge. It ensures to our clients that we are aware of the treatments, we are aware of the services, and we're up to date on and in the know, so to speak. And again, building trust, that's huge. If we're knowledgeable about the research, about the trends, about the treatments, it does increase our credibility. And that will build trust with our clients. They're going to be like, well, they know what they're talking about. They are well informed. And so, I trust what they say. I trust their opinions and I trust the information that they're giving me. So how can we do that? How do we stay informed as peers? Kentucky Department for Public Health, CDC, World Health Organizations, your local health agencies. So making sure that we're regularly reviewing these trusted sources and that we're staying up to date or even on their mailing lists. Also, make sure that you're participating in ongoing current education, just like you're doing today. So participating in webinars, conferences, local trainings, even TED Talks are very informative. I really like those. So making sure that we're educating ourselves. And also engaging with healthcare providers, staying connected with those individuals and those specialists who are providing those treatments and who are in the know on some of the most up-to-date treatments and up-to-date knowledge when it comes to hepatitis C. The next thing I want to hit on is having the conversation. Many times we assume that our clients or our peers have this information. If they're using substances, if they're participating in risky behaviors, whatever the case may be, we automatically assume because they're part of a certain population that they have this knowledge, that they know these things. And that's not the case a lot of times. And so one of the things I want to ask you to do is just don't assume and continue to educate. Even if you think they've probably heard this by now, or they probably know this, always provide that piece of education because it may be something they don't know. It may be something they've forgotten, or it may be something that they have heard along the way, but they weren't really sure about it, right? And so we want to avoid those assumptions. You may have clients who are positive for hepatitis C who are seeking harm reduction for prevention of hepatitis C. And just because they're coming to you and seeking those services and they know the lingo, they're talking the language, it doesn't mean they know about the latest treatment options or they know about the risks involved in continuing these behaviors and not practicing these preventative efforts. Provide that opportunity for education. Again, even if your client appears knowledgeable, there may be critical pieces of information that are missing. And they may have not been exposed to that type of information or that piece of that puzzle, or it may be something that they know of, but they have a misunderstanding about. So make sure that you're providing that education and build that partnership. Open conversations again to build trust and show that you're interested in their health and their well-being. Next, I really just want to touch, I know Katie did a great job talking about this with her true and false quizzes throughout the presentation. I really thought that was wonderful and super helpful. I want to talk about some misinformation about hepatitis C, some myths and some facts, just very briefly. The first myth is you can only get hepatitis C from sharing needles, or you hear this one a lot, I gave hepatitis C to myself. A lot of times, many people think, well, I never shared syringes. How did I get it? I must have given it to myself. And so many people don't know that hepatitis C can be spread through cookers, through works, tourniquets, lots of different methods, even through snorting straws. And they don't realize that they've shared other tools that have blood on them and they can get it that way. They only think it's the syringe that they can get it from. A lot of people are misinformed and don't know that the other works that are involved in substance use can be, a carrier for that hepatitis C virus. So again, sharing razors that are contaminated with positive hepatitis C blood. Lots of different pathways for hepatitis C to be transmitted that people don't know about. The second myth, hepatitis C symptoms are always noticeable. That is untrue. The fact is that many people don't experience hepatitis C symptoms for decades. That's why testing is critical. And I know someone in the chat said earlier, making sure that we're testing regularly, not just testing once, but putting it into practice, maybe even as part of your yearly exam, your annual well check, making sure that you're being checked for those bloodborne pathogens like hepatitis C. The third myth is if you have hepatitis C, it's too late for treatment, and that's not the case. Hepatitis C treatments are highly effective. The cure rates are over 90%. And with early diagnosis and treatment, lots of people can clear the virus from their system and get that cure. So just because you have hepatitis C does not mean that it's too late for treatment. Moving on to the fourth myth, if you're feeling fine, don't worry about it. That's not true. A lot of times, the damage that hepatitis C causes is being caused without those symptoms, without those feelings of illness. So it can cause long-term damage to the liver, it can cause cirrhosis, and it can lead to cancer over a period of time. The fifth myth, if you're cured of hepatitis C, you can't get it again. That's untrue. The fact is, while hepatitis C treatment can cure the virus, you can become reinfected if you are re-exposed to hepatitis C. Finally, the sixth myth. Hepatitis C treatment's too hard and it's going to make me too sick. Not necessarily so. The current treatments are so much easier than what they were in the past. These treatments that referring to the myth, they made me sick or I just couldn't tolerate the treatments, those are old methods of treatment. And so now we have medications that are taken daily for 8 to 12 weeks. The side effects are much fewer than what they were in the past. The next thing I want to touch on is making sure that you're having that conversation and encouraging testing for HIV and other sexually transmitted infections, so other STIs. Making sure that you're saying, okay, yes, you could be positive or you are positive, or we're practicing behaviors that will reduce your likelihood of getting Hep C, but we want to also talk about some of the other factors as well. The likelihood of someone with hepatitis C having another STI is great. And so it's very likely that they need protection from other STIs and they need regular testing for that as well. Again, early detection can save lives when we're talking about testing for other sexually transmitted infections. When we are educating, we are empowering. We also want to make sure that we're explaining the importance of knowing and being a part of the regular health screenings. We want to normalize testing. There's so much taboo when we're talking about STIs. We want to normalize the conversation around that and reduce the stigma by making it part of a regular healthcare routine. So we want to normalize testing. We don't want it to become so taboo like it has been in the past. And then finally, we want to provide resources, connecting clients to free or low-cost options. Just a quick stat, 30% of a co-infection rate. So if you have hepatitis C and you're positive for hepatitis C, the likelihood or the co-infection rate of an HIV and hepatitis C positive person is 30%. And so it's so important that people get tested not only for hepatitis C, but for all of those STIs. So how do we do that? How do we create a relationship within our community so that we can refer those individuals to those free treatments, just like we talked about? And the way we do that is developing community partnerships. We must be able to develop relationships with local resources. We want to engage in our community coalitions and our community meetings regularly, making sure to attend events or networking opportunities, whether it's with providers or whether it is with people who are working in similar fields in your area. That creates an opportunity for us to advocate for clients, bridging that gap to care. if we are able to have a relationship with the provider or have a relationship with individuals who are providing similar services in our area, we are creating connections. We are able to collaborate with those folks. And if we have a relationship and we've built that conversation with them and they know who we are in that community, they know the services that we provide, we are going to be able to create a relationship in which we can reach out and advocate for our clients' health in the future. And so, one of the things that I do is I attend so many different coalition meetings, even if it's virtual or in person. And I let them know what it is that I do in the community, the population of individuals that I advocate for. And also, I have a relationship to where if one of my clients is positive for hepatitis C and they get a new diagnosis, one of the things that I can do is I can call the care clinic and I can say, this is Pam Sulfridge with UK Healthcare, and I have someone here who is positive. Can we get them treatment today? The reason I say today is because I have had so many become positive, get an appointment, and not show up for their care. And they're very motivated when they first find out or when you're first having that conversation. So making sure that we remove the barrier of transportation at a later date, making sure that we remove that barrier of maybe going back and forth or being ambivalent about having that treatment. So what we can do at that point is get them in with that partner at that time. And so we have the ability, because we've made that connection, to reach out to that community partner and say, hey, we, have this positive person and we want to, get them in for care. And a lot of times those people that I've built those relationships with will see them that day. And stay informed, making sure that you know about the resources in your community, making sure that you know what's available to you for your clients. And when you are making that connection, create that in a space where you are able to perform a warm handoff. And this is creating that personal introduction between your client and service provider that you're introducing them to. And how do we do this warm handoff? So first we want to introduce the client, whether you're doing it in person or whether you're doing it virtually, making sure, or even through a phone call, making sure that you're introducing that client and all parties involved are able to be part of the conversation. Share relevant information with the client's consent. So making sure that you have the client's informed consent. You can provide those details along with your client that's there with you to that new provider. Reduce barriers. If you have a system that the client is not used to navigating, making sure that you're able to help them navigate through all the red tape, through all the loopholes, set up transportation, whatever the case may be, making sure again that you have access to those resources and that you have a connection with those resources so that when you reach out, you are able to better advocate for your clients. And stay engaged, making sure that you're there to offer reassurance throughout this relationship with your client. You're able to be available for questions and that you're following up with the provider and with your client when possible. So when we're talking about bridging the gap to care and advocating for our clients, our role as peers is making sure that we have created relationships that we can call on when our clients need their service. That's one of the most important things that I could tell you during my portion of this webinar, making sure that what you're doing is creating those relationships, that people know who you are, you know what is available in your community, and that you have built relationships with these entities so that you can advocate for your clients. There was a application, I don't know if you've heard about it, it's the Recovery Ready Communities application that we just completed that in Bell County. And it's an extensive rubric, to be quite honest. Just to let you know, though, as I was going through this, and I've worked, like I said, in this field for years, and as I was going through this rubric, a team of us had worked on this, and we were coming together with these resources and saying, okay, our county either has this or they don't, and we were breaking down the rubric. There were so many different resources in the county that I was unaware of until we did this Recovery Ready Community application. So a couple of things that I would advise is, if you have not looked at the Recovery Ready rubric, to see your county might fit, do that. Look and see what resources you have that you don't know about. If you have a Recovery Ready Community application that's been completed, ask if you can get a copy of those resources they provided in the application. Also, find out, are there resource booklets? Are there I know a lot of people have resource guides in some of their community coalitions. Are those available in your community? Making sure that in each of those sectors, you have at least 3 connections, so that you know, if it's transportation, you have at least 3 connections that you can reach out to for your clients in regards to transportation. And they're going to know who you are and why you're reaching out as soon as they hear you on the other end. If it's housing, making sure that you have that connection with individuals who can provide that resource to your clients. So some final tips and takeaways. Empathy is essential, making sure that we're approaching our peers with understanding and non-judgment, meeting them where they are and not leaving them there. Sharing accurate information, making sure that we're in the know and we're able to provide reliable, up-to-date information about hepatitis C treatment, prevention, and resources. Encouraging treatment, helping our peers to understand that hepatitis C treatment is effective, it's manageable, and it can be cured. Support their journey, making sure that we're offering emotional motivation, support, and encouragement throughout this process. Finally, share that harm reduction education, share the strategies that are available in your community. And be a role model, making sure that you're leading by example. Your own recovery and your approach can inspire and motivate others. Finally, connect to resources. Always be ready to provide and connect peers with local resources such as medical care, financial assistance, and peer support networks. All right, so this is again my contact information. Any questions?
Thank you so much, Pam and Katie. That was magnificent. And if anyone has questions, please feel free to put those in the chat. I learned so much today. I literally made a whole page of notes. Looks like Katie's putting some, extra resources and contact information in the chat. Hey, Katie, will you send that to everyone? It looks like it's only going to the hosts and the panelists.
Yeah, I tried to do that. I can't.
Oh, maybe you don't have permission.
Yeah.
Maybe Amanda could copy and paste that.
Yeah.
But learning that, I mean, most importantly, that Hep C, there is a cure, there's a pathway to elimination. I learned a new word. Syndemic was new to me today, and my jaw hit the floor when you said that Hep C can live outside the body for 6 weeks. I went, what? Wrote that down. And in the bridge between your 2 presentations and how this, as far as the role of the peer and working with participants and people in recovery, clients, comes down to this conversation. And I just love how Pam, made it really clear that we're not responsible for the outcome, but we're responsible for the environment and how we show up, and showing up non-judgmentally, and showing up, creating a safe place, being encouraging, active listening, and also being empowered with our own resources. I love that you told people to go to trainings and go to webinars, because I think that's important too. And staying on the mailing list. we're right here at the end of time. I don't see any extra questions that have come through. The link for the continuing education certificate is in the chat, that short survey. Yeah, so that concludes the webinar. Thanks everybody for attending today. Thank you again, Katie, and thank you, Pam.
Thank you so much for having me.